Cervical cancer is the fourth most common cancer among women worldwide. Every year, over 350,000 women die from it. The best way to prevent this disease is by being aware of it. In this video, we will explain what cervical cancer is, why it happens, its symptoms, and how it can be prevented. Every year, about 660,000 new cases of cervical cancer are reported globally. Out of these, 350,000 women die. The global mortality rate for cervical cancer is 9.1%, but it's much higher in low-income countries, in sub-Saharan Africa, parts of Asia, and Middle East. In fact, 95% of all deaths from cervical cancer happen in these areas because of a lack of financial resources and basic medical facilities. So, what exactly is cervical cancer? In women, the cervix is the lower part of the uterus that connects to the vagina. The primary cause of cervical cancer is an infection in the cells of the cervix, mainly due to the human papillomavirus, also called HPV. Usually, this virus becomes inactive in the body. But in women with low immune resistance, the virus can persist for many years. In about 5% of cases, it stays in the body for a long time and gradually spreads. Over time, this persistent virus can cause changes in the cells of the cervix, affecting their DNA, and leading to abnormal cell growth, which can form a tumor. Cervical cancer grows slowly, so if it's detected early, it can be treated successfully. Now, let's clear up a common confusion: the difference between cervical cancer and cervical issues. People often confuse cervical cancer with cervical issues. When people say cervical, they often mean neck pain. But cervical cancer refers to cancer of the cervix, the lower part of the uterus. Our spine is divided into 5 parts: cervical, thoracic, lumbar, sacrum, and coccyx. The cervical part is the neck area. Cervical spondylosis is a neck condition that causes pain, often referred to simply as cervical. Symptoms of cervical cancer. In the early stages, cervical cancer doesn't show any symptoms. Symptoms appear only when the cancer has spread significantly, such as unusual vaginal bleeding, such as after sex, between periods, or after menopause. Pain during sex. Unusual vaginal discharge, which may be watery, bloody, or foul-smelling. Pain in the pelvis or lower abdomen. Swelling in the legs. Lower back pain, weight loss, loss of appetite, fatigue, and difficulty urinating or defecating. When should you see a doctor? If you experience unusual vaginal bleeding, like after sex, between periods, or after menopause, it's not normal, and you should see a doctor immediately. How is cervical cancer treated? 2 main tests are used to detect cervical cancer. 1. Pap test. This test checks for abnormal changes in the DNA of cervical cells. 2. HPV test. This test checks for HPV infection in the cervical cells. Once cervical cancer is detected, doctors decide on the treatment, which might include medication, chemotherapy, radiation therapy, and more. How to prevent cervical cancer. To prevent cervical cancer, it's important to take preventive measures from the beginning. These include getting the HPV vaccine, avoiding sexual relations with multiple partners, quitting smoking, using condoms during sex, at a few-year intervals having Pap tests. For more detailed information, you can read an article on our blog, Web Safranama. If you found this video helpful, please like it. If not, feel free to dislike it. To get more informative videos like this in the future, subscribe to our channel. Till then, stay happy and stay safe.